Hello, my name is Nicholas Hampton, and today I would like to share with you the effects of sickle cell anemia on patients and families. Imagine laying in a hospital bed, afraid to move, afraid to breathe, even afraid to think. You feel like you feel like a punching bag for an MMA boxer, or like your bowling ball has hit you several times. You are in the worst pain you have ever felt. This is a common scenario for most sickle cell patients. Every sickle cell patient grows through their disease differently. Some patients may be hospitalized more than others. There are different pain medications to manage pain. The cost for over-the-counter medication and prescription medication can be very bad. The cost for pain medication for patients can affect families tremendously. The physical and psychological effects of sickle cell on a patient and their families can be traumatic. Sickle cell anemia is a genetic blood disorder that is inherited from the parents. It affects the red blood cells in our bloodstream. Sickle cell anemia is caused by the abnormal hemoglobin called hemoglobin S. Hemoglobin is the protein inside our body that carries oxygen through our blood vessels. Sometimes our red blood cells for sickle cell patients become hard and sickle shaped, which makes it harder for them to move out through the body. Sickle cell is an inherited blood disorder. You get both genes from both of your parents. If you only get one gene from one parent, you then have the traits. Sickle cell patients have common descent of Africa and the Mediterranean. You can also find sickle cell in patients who have descent of Central America, South America, the Caribbean, and the Middle East. Sickle cell causes severe pain crisis, which is an episode of pain a patient may go through. You can have pain in your leg, joints, wrists, arms, and head and chest areas. One symptom of a sickle cell crisis is a stroke. Other symptoms include fatigue, rapid heart rate, shortness of breath, and jaundice, which is the yellowing of eyes and skin. Because of the chronic nature of sickle cell, there is a strain on families financially. For families with private insurance, there is often a copay which they may not be able to afford. Caregivers for the patients often have to miss work in order to take care of the patient. Patients with sickle cell disease may question their ability to succeed in life because of their physical limitations. Often, sickle cell patients are smaller than their other peers, so which causes them to be bullied and ostracized. Sickle cell adds a barrier for patients as children because they may want to do physical activities which they commonly cannot do. Lower self-esteem and high levels of anxiety and depression have been found in patients. There is often added stress on a child because of the lack of knowledge from peers, teachers, and administration of the school they attend. Sickle cell patients miss many days of school, which then causes them to fall behind on their work. The anemia part of sickle cell can cause a lack of attention, focus, and cause memory problems for a child during school. Early diagnosis and newborn screenings is commonly done now. Penicillin, pneumococcal vaccinations, and folic acid supplements are often given to young children. Regular care with a primary doctor and a specialist, often a hematologist or oncologist, are needed for patients. The use of Motrin, Tylenol, and prescription medication are often used to manage pain at home. Relaxation and coping techniques help patients take their mind off of the pain or distract them so they're not focused solely on that one thing. Intravenous fluids and narcotic medication are often given during hospitalizations of a patient. Hydroxyurea, an FDA-approved low-dose chemotherapy drug prescribed to patients, helps create fetal hemoglobin in patients, which aids in the lessening of sickle cells. Exjade is a medicine used to help treat patients for iron overload if they choose to do a chronic blood transfusion. Chronic blood transfusions help prevent complications of sickle cell disease by lowering the amount of hemoglobin S in the body. They also help lower the risk of stroke in young children and infants. Currently, the only potential cure for sickle cell disease is a stem cell transplant. Stem cell transplant requires healthy bone marrow taken from a matched donor, to be placed inside the patient. Commonly, the recovery time for a transplant is 8 to 12 months. Sickle cell disease is a chronic illness that complicates the lives of sickle cell patients and their families. The management of sickle cell disease is costly financially, socially, and emotionally to everyone. Living with sickle cell disease is not a death sentence. With proper care, management, and support, those living with disease can live a full and healthy life. Thank you.